Definition: a pressure shock is a localized injury to the skin or the underlying tissue. It is caused by a prolonged pressure in the open or the body surfaces. May also result from the shear friction and the pressure. Now the common names of the pressure shock is also known as the bed shocks, the pressure ulcer and the decubitus ulcer. Now the common site or the body prominences in the supine position, sacrum, heels, elbow and the occiput are more common. The sideline, left locator of the knee, malleolus or the ankle and the shoulder is most prominent. And also ear and the elbow are the prominent side. In the sitting position, ischial tuberosity, scapula and the spine, we can see over in the image. Now the cause of the pressure. It's caused by a prolonged pressure on the skin and the tissue, shearing a force, sliding in the bed and the chair for a prolonged period of time, friction, rubbing against the seats, moisture like a sweat, urine, feces, network, maceration, poor nutrition, immobility like a paralysis, coma and post-surgical patient, immobilization given to recovery, weakness the sensation like a neuropathy and spinal cord injury patient, and the early and the deep diabetes patient. Now the risk factor for the pressure shock. Elderly individual, there are loss of the sensation or with diabetes there is the less sensation. Bedridden or the wheelchair bound patient, malnutrition or the dehydration can cause a pressure shock. Diabetes patient, stroke and spinal cord injury which have immobilized patient for the prolonged period of time for the recovery. Incontinence patient due to a urine leakage, there is the more chances of the pressure shock. Poor hygiene and the low body weight or the obese patient may develop pressure shock. Now the pathophysiology behind the pressure shock. Sustained up pressure can produce a blood flow. It's made of ischemia. Ischemia lead to a cell death and the tissue necrosis that cause a open wound and increase the risk of infection and cause a pressure shock. Now the stages of the pressure shock. Stage 1, red non-glandular skin, no open wound is present. Stage 2, partial thickness and the loss of the skin. Stage 3, partial bone thickness and the tissue loss, but not muscle and bone. Stage 4, full thickness loss is expose the bone muscles for the tendon. Now the unstageable, ulcer covered by the slouch and tissue like the wrist, leg tissue and the leg unhealed, deep tissue injury, corporal and the mobile skin discoloration, deep soft tissue damage suspected. Now what is the sign and symptom? It's a redness, pain and tenderness, swelling, warm in the stage 1 to 4, and the open wound after the stage 4, and the pulse and pulse smelling discharge in the stage 5, and the black tissue in the severe cases in the stage 6. Complication: it's caused by infection like the cellulitis, osteomyelitis, and the sepsis, chronic non-healing wounds, pain over the wound area, social isolation because of the pressure shock is not a very great day in the severe untreated cases. Now, what are the prevention of the pressure? We can prevent to give a patient a frequent positional change every 2 hours for the bedridden, every 15 to 40 minutes. Now the role of the physiotherapist in the open pressure source, like a mobilization exercise to improve a blood circulation, positional technique to change a frequent position and the relief of the patient, pressure relief education, use of the supportive device, and the functional training like transfer and the wheelchair skills. My reference is this book, Krishners and the